Hi, this is Dr. Bunkis, Orange County Plastic Surgery, Corona Del Mar, Newport Beach, California. Today we're going to be doing an outpatient procedure on this Asian female who dislikes her upper lids. The upper lid procedure that we do in most Caucasians removes a little skin and accentuates the fold that they have above the eyelashes. But some of these Asian patients do not have a fold at all because the skin does not attach down to the cartilage when they open their eye. And what we're going to do is take out a little bit of skin and we're going to sew the upper skin down to the end of the cartilage plate and back up to the skin, so when she opens her eyes she'll make a little fold. And this is her. We're going to go to the operating room in a few minutes and I'll show you how the procedure is done. But obviously I can't show you her final result today, so I'll show you another patient with a similar situation. As you can see, she does not have any kind of a fold at all. This was not a skin excess issue. It's just that the end of the cartilage plate doesn't attach up to the skin. So what we're doing here is taking out a little skin, sewing the cartilage down to the skin, so when she opens her eyes she makes a little fold. Let's go to the operating room and I'll show you how it's done. Hi, this is Dr. Bunkis, Orange County Plastic Surgery in Corona Del Mar, California. Today we're doing upper lid blepharoplasty in a patient in the office. She's Asian. She does not have a supratarsal fold. Can you open your eyes, dear? When she opens her eyes, her skin kind of hangs down on her lashes. We're going to take out a little piece of extra skin, but then we're going to sew the skin down to the top of the cartilage plate to give her a little bit of a fold. And you can go ahead and close your eyes, dear. You're going to feel a little pinprick. This is the local going in, and this is as bad as it's going to get. And this medication is called xylocaine, and it has some epinephrine mixed in with it. And the epinephrine causes blood vessels to constrict, and you're going to be amazed how little blood loss there is in this procedure. Normally if you cut somebody's eyelid or cheek or something, they bleed and bleed and bleed, but here you'll hardly see any blood at all. And that's helpful for me as a surgeon to have a nice dry field, but also for her, she's going to have far less bruising and a much more rapid recovery. Okay, so the incision will be made just through the skin, down to the muscle, but not into the muscle. As we discussed earlier, it's very important to keep the ice going. If you keep the ice going, it's not going to swell as much, not going to hurt much, you won't bruise as much. When I see you next week to have your stitches taken out, you shouldn't have any bruising. You can see that the skin has been taken out. This fine little layer here is the orbicularis oculi muscle. And I will just cauterize it a bit because I'm going to take out a little strip of the muscle. It's a very thin little muscle called the orbicularis oculi, and we're just taking out the muscle. I'm going to put in 3 sutures from the edge of the skin down to the cartilage, into the skin on the other side, and as this heals, it'll give her a little bit of a fold. This is the top of her cartilage plate. Can you open your eye, dear? See if she
Can
opens. Yeah, just go ahead. As she opens, see how that pulls that in. That'll give her a little fold. Okay, you can close your eye, dear. And once we put in the little stitches to create the fold, then it's just a very normal eyelid closure where we just run a suture along the between the two edges. And what she's going to do is clean this incision with Q-tips and peroxide, put a little Vaseline on here a couple times a day, so that when she comes back in a week, this will be a nice clean incision. I can see all the sutures. And you can see how little it bled, how little blood loss there was, not even 1 cc. And as soon as I finish, I'll have her open her eyes, just to show you the difference between the two sides. You can see how this eye is going to open with a little bit of a fold, and this one obviously hasn't been done yet. That's how we do Asian upper lids at Orange County Plastic Surgery in Newport Beach, California.